Welcome back. We continue to see positive signs in the fight against coronavirus with new cases trending down and a new vaccine booster for kids on the horizon. I'm joined this afternoon by Dr. Jeff Pothof from UW Health. Dr. Pothof, it's good to see you. Thanks for being here again. I want to start by asking about masks in nursing homes and in hospitals. The CDC recently easing guidelines there. What is the motive behind some of those changes?
As we've gone through the pandemic, hospitals and nursing homes have used a different map than what the general community is used to. We use this map called the transmission level. And what we're looking for is the transmission level to drop to that moderate or low area. And if it does, the need for masks starts to go away because there's so few people in the community that actually have COVID that you don't get a lot of benefit from it. Now, unfortunately, in Wisconsin, we don't have many places in moderate or low transmission levels. The only place right now would be Florence County up near the Upper Peninsula of Michigan. Both Milwaukee County and here in Dane County, we are in very high transmission levels. So I don't think you're going to see any significant changes in the health systems around here until our transmission levels come down a little bit.
And we'll have an eye on that for sure. Let's turn next to a new Omicron-specific booster shot for kids 5 to 11. What do we know about it, and when do you think that could be approved?
Yeah, so we know that both Moderna and Pfizer have this ready to go. I think the approval will likely come sometime in the middle of October. What that would mean is then children, and depending on their age, would kind of determine which vaccine they might be eligible for. But those children, if they haven't been boosted in the last 2 months, will then be eligible for one of these bivalent boosters, these boosters that cover BA4 and BA5, which are the most common subvariants of Omicron circulating in our community right now.
Okay, so mid-October, that is a time for parents to be paying attention to. The pandemic might be winding down, but COVID is still marked as a leading cause of death right now in the U.S. And do you think a change to that will come anytime soon?
I think we're going to see COVID-19 in the top 10 leading causes of death in the United States for many years to come. When we look at number 9 or 10, usually that is actually influenza. In a good year, we lose about 12,000 loved ones to influenza. In a bad year, about 50 or 60,000. By comparison, COVID, even now, not in the throes of pandemic, we're still losing approximately 110 to 190,000 Americans per year. So not only in the top 10, but probably in the top 5 for the years to come.
Okay, some sobering numbers. Dr. Pothof, thank you so much for your time and for your insight on this Tuesday afternoon.